Now we are moving to the next page. We can talk here about respiratory burst. Is also called as oxidative burst. Involves the activations of the phagocytes, that is NADPS oxidase complex. Examples in neutrophil monocytes. Now, which utilizes OT as a substrate, play an important role in the immune response. Now, rapid release of reactive oxygen species, that is ROS. Now, NADPS play a role in both creations and neutralizations of ROS, that is reactive oxygen species. Now, myeloperoxidase contains a blue-greens, that is heme-containing pigments that gives sputums its color. No safe microbes, that is NADPS oxidase, that is superoxides dismutase myeloperoxidase. Now here it is explained very well that like O2 is converted to superoxides in that is NADPS is converted to NADPS positives. Now superoxides to H2O2, that is number 2, that is in presence of that is superoxide dismutase. Similarly, H2O2 is converted to HOCl, that is hypochlorite bleach. Okay, and presence of that is myeloperoxidase. Similarly, HOCl, that is hypochlorite bleach, is converted to HOCl is can causing bacteria lysis. Okay, similarly here we can see that if phagocytes of the patients with CGD, chronic granulomatous disease, okay, can utilize H2O2 generated by invading organisms and convert it to ROS. Now patients at increased risk for infections by catalase positive species like S. aureus, aspergillus, capable of neutralizing their own H2O2, leaving phagocytes without ROS for fighting infections. Now pyocyanins of P. aeruginosa generates ROS to kill competing pathogens. Oxidative burst leads to release of lysosomal enzymes. Now here we talk about interferons. The interferons alpha, interferons that is beta, and interferons gamma. Now mechanisms are a part of innate host defense. Interferons interferes with both RNA and DNA viruses. Cells infected with a virus synthesize these glycoproteins, which acts on local cells, priming them for viral defense by down-regulating protein synthesis to resist potential viral replications, and by upregulating MHC expressions to facilitate recognition of infected cells. Also play a major role in activating anti-tumors immunity. Now talking about clinical uses, chronic B hepatitis virus B, that is Kaposis and Kaposi sarcoma, hairy cells leukemia, condyloma acuminatum, renal cells carcinoma, malignant melanoma, multiple sclerosis, chronic granulomatous disease. Now about adverse effect, flu-like symptoms, depressions, neutropenia, myopathy, interference induced autoimmunity. Now this much for now. Thank you so much.